Hello, my name is Michelle Manso, and today I will be presenting my PowerPoint presentation on the health belief model. The health belief model is one of the first theories of health behavior. It was developed in the 1950s by a group of U.S. Public Health Service psychologists who wanted to explain why people were so different in participating in programs and preventing and detecting diseases. The health belief model is a good model for addressing problem behaviors that evoke certain health concerns. The health belief model proposes that a person's health related behavior depends on four different critical areas. The first critical area is the severity of the potential illness that could be brought on to the patient. The second is the person's susceptibility to that actual illness. The third are the benefits of taking the preventative action, and then the fourth are the barriers to taking that action. The health belief model is a model that is applied in nursing, especially in issues focusing on patient compliance and also on the preventative healthcare practices that we teach these patients on a daily basis. The healthcare belief shows the relationship between a person's personal belief and their behaviors that reflect that. There are six major concepts in this health belief model. They are perceived susceptibility, perceived severity, perceived benefits, perceived costs, motivation, and enabling or modifying factors. In this first concept, the susceptibility refers to a patient's perception that this actual health problem is either personally relevant or that their diagnosis of the illness is actually accurate. The perceived severity is when one person recognizes their susceptibility. Their action will not occur unless the individual perceives that the severity is high enough to have a serious outcome or a potential outcome for this person. The benefits refers to the patient's belief that any given treatment will either help cure this illness that they may have or help prevent it. The costs refer to how long the patient needs to have treatment, the accessibility to the treatment, and the actual complexity of the treatment. Motivation refers to their desire to actually comply with the treatment and the belief that they should do what they want. Modifying factors are their patient satisfaction, other variables that could be included, such as where they live, the financial aspects, and socio-demographic factors that may perceive to this patient. Health belief regarding contraceptives. In the article that I have chosen, the study design was a survey that was administered at a federal clinic in which incorporated a health belief model to determine the patient's emphasis in pregnancy prevention. The use of contraceptives for prevention of pregnancy and prevention of sexually transmitted infections and sexually transmitted diseases. The saying knowledge equals power did show positive here in correlation between the perceived benefit regarding the ease and the use of educational level increased the perceived barriers due to the side effects as the income level decreased emerged. Special counseling by practitioners to improve patient self-efficacy showed contraceptive adherence. Knowledge and equals power when it came to contraceptive use. The more the patients were informed and the more knowledge that they gained regarding contraceptives, the more that the patients adhered to the contraceptive guidelines and how to use these. And these are references that were used in this PowerPoint presentation. Thank you for listening.